into a space where beauty meets authenticity and transformation is not just a possibility, but a promise. I'm absolutely thrilled to introduce you to someone truly special, Dr. Rukmini Vinaya Rednam, the compassionate force behind the countless remarkable transformations in the vibrant city of Houston, Texas. Picture this: every curve, every contour crafted with care and expertise, not just by a board-certified plastic surgeon, but your very own cheerleader for self-discovery and confidence. Get ready to embark on a journey where we explore the art of science of feeling your very best self. This isn't just a podcast. It's your cozy corner of empowerment and inspiration. So pull up a chair, pour yourself a cup of kindness, and let's dive into the Confidence Doc podcast with Dr. Rukmini Vinaya Rednam.
Welcome to this recap episode where we will show our favorite moments.
Hello, I'm Dr. Rednam, and welcome to the Confidence Doc podcast. With me today, I have my two lovely patient care coordinators, Candace and Cheryl. Do you each want to tell a little bit about yourself?
My name is Candace. I've been a patient care coordinator for about 11 years now, and I have a background in medical, administrative. I've done breast reconstruction as well as cosmetics sales now that I'm with Dr. Rednam. Patient care is a big deal, and I love it here.
Hi, my name's Cheryl. I'm Dr. Rednam's patient care coordinator. I've been a patient care coordinator for almost 11 years as well, and been with Dr. Rednam now about 5 years.
Well, I'm very lucky to have these two ladies with me. It's a big part of my job because while I am a plastic surgeon, everything is centered around our patients and patient care. So a little bit about my practice. I am a plastic surgeon that does surgery on the face, the body, pretty much everything you can think of. The one thing I do not do is rhinoplasty noses. I have wonderful partners who focus on that area. But one of the things that is near and dear to my heart, which I really want to be able to focus on this podcast, is post-weight loss, body contouring, as well as facial surgery. It's a really unique area, not only post-weight loss after having surgery, but also now with all the new medications that are aboard, we've seen so many more people who are losing dramatic amounts of weight. Wouldn't you agree, ladies?
Absolutely.
The big thing with post-weight loss is it's rarely one surgery. It can be multiple surgeries. It can be stage surgeries. There are times that I've taken care of some people for years. It's more of a journey than it is just one single destination when it comes to post-weight loss surgery. But I think that what I like about it is not just the creativity with it, but we get to make such strong and personal relationships with our patients. And that really starts with my patient care coordinators. So I'm going to turn it over to them so they can kind of explain how the process works when you come and you want to meet with us. Welcome back, everyone. We are going to talk about my favorite surgery today, the body lift. Go ahead, Cheryl. I know you want to say
It's my favorite procedure.
Yes.
So let's start from the beginning. So how do you know that you need a body lift? I will tell you that everyone throws around tummy tucks, and we know what a tummy tuck is. I've got extra skin, I got that belly tissue that hangs over, and I want my belly to look flat. But very few people really understand what a body lift is. So I'm going to briefly go into what a body lift is from a basic standpoint. A body lift is if I take a tummy tuck, and then I add a butt lift, and then I add a lateral thigh and kind of the side of your waist flank contouring and lift to it. So basically, I'm doing a tummy tuck that goes all the way around. With a tummy tuck in the front part, I'm doing liposuction. If you are a woman, I'm tightening the muscles if you have that separation. And then I'm really contouring. The goal is to really give you a nice snug waistline and with a little bit of flare at your hips. Now that can change depending on what particular look you want. Some ladies like to have that more sculpted look that's like an athletic look. And some people really are like, I just want to look flat. These are all things that I'm going to discuss with you in your consultation because it shouldn't look like every one of my tummy tucks looks exactly the same. It should look like the way that you're kind of hoping and wanting to achieve that look. What the achieve in the back, and we'll go to the sides here in a minute, but in the back, it really lifts your bottom up. It's not really pulling anything down. If you can imagine, if you pull on your back, it's really kind of fixed there. So it's not going to do anything for your upper back. I often will do 360 lipo with a body lift to really get things as smooth as possible. But it's really about getting that kind of ring of tissue that sits above your butt that people think is your butt, but it's not your butt. It's really just that upper back kind of like muffins out tissue. What's the negative sometimes to doing that part of the surgery is that sometimes it can flatten your bottom out if you've lost a significant amount of weight. However, if you're maybe somebody that's lost some, not a lot, but just has that laxity, it can give you the perfect butt shape. On the sides, it does two things. So you're lifting up the lateral aspect of your thighs. So if you're someone that has those really heavy saddlebags, I liposuction them and I can actually cut it out enough to lift it that you can get that nice smooth look on the sides. And especially from the top down on your abdomen, it's pulling everything down. So it gives you that really contoured look. And the nice thing with the body lift, because I'm internally going all the way around, the best way I can say is I really sculpt internally. So I can sculpt things down to where you have like a really, really killer curve. It's something very different than you can achieve with just a tummy tuck alone. And a body lift, again, is reserved for people who really have that excess. It's not something I do if you really have a smooth back area and a smooth side area. So Cheryl and Candace, like when you get pictures or somebody calls in, how do you kind of first talk to them about a body lift and how, like, what's your thought process when you see these photos and are talking to people?
Patients typically won't send me photos in the beginning. We typically get them first on the phone. So the first and foremost, I mean, there's a series of questions that Candace and I like to ask patients. If you've had weight loss surgery, if you had a wonderful result with weight loss surgery, and so you've lost, more than 20 pounds at that point, you're really telling me that you've lost anywhere closer to like 50 to sometimes 200 pounds, 300 pounds. We've heard quite a bit. Then we know that you have quite a bit of skin already from just that alone. But everybody also has a genetic makeup and how that skin falls, how much you have, things of that nature are really going to play into what we're visualizing while we have you on the phone. And if I have a patient on the phone and I feel like I can't visualize it, they could be almost a borderline. Maybe Dr. Rednam would say you're a tummy tuck. Maybe she'd say you're a body lift. Then I will ask for photos. And just because I want to make sure, and sometimes it's just better to have Dr. Rednam take a look. But I would say about 90% of the time, Candace and I can typically visualize what the patient looks like before they come in to meet with Dr. Rednam.
Yeah, because a lot of body lifts are unpredictable.
That's correct.
The information they give you over the phone, it's like, you sound like you may be a body lift. You sound like you could be extended tummy tuck. So the photos is always the telltale sign. And then, you can get photos and patient has a lot of laxity up front and back is smooth as I don't know what. And so you're like, well, wow. It still needs a body lift, but doesn't really need too much liposuction to the back because it's a lot of it. It's pretty flat, but you get people that also need fleur-de-lis body lifts. They got a lot of laxity that goes inward, and it's hard to tell over the phone. Are you a fleur-de-lis, or do you need just a traditional body lift, or you extended tummy tuck? So definitely the pictures let us know what you're candidate for.
I'm here again with Cheryl and Candace, my brilliant patient care coordinators. We wanted to talk about something that we actually see a lot of that isn't really talked about a lot. If you have this is really going to resonate with you. And we want to talk about capsular contracture. Let's talk about what naturally happens when you have an implant. When an implant gets placed, whether it's above or below the muscle, it makes a really thin layer of cells that's called a capsule. And if you think about it, it's a medical device. It's what your body does to kind of keep it in that space. It happens just over a few weeks after the implant's there. It's why if you push your implant, it doesn't go over to your back. So you want a capsule to form. But what ends up happening, and I'm quoting national rates. So nationally, about 5% of women will develop a capsular contracture. So what that means is that little layer of cells gets firmer. Some sort of inflammatory response occurs and that gets firmer. Half of those women, it'll have a grade 1 or grade 2 capsule, which means if I can feel it, you may not necessarily notice it. Cosmetically doesn't make any difference. There's really nothing much that we have to do for that. If it is grade 3 or grade 4, and there's only 4 grades, then it actually can not only become noticeable where you're like, my breast doesn't look normal, but it can become painful. In those cases, we do have to surgically intervene. And so what that means is I have to go back in and I remove the entire implant and the capsule, and we have to start from fresh. I probably do more capsular contracture revisions that are other people's surgeries than I do of my own. I would not be honest if I told you I've never had a capsular contracture, because if you do enough breast augmentations, you will absolutely get one, because there are factors that you can't control. We think the reason why we develop capsular contractures is most likely some sort of micro-infection or something else that stimulates your body to go into this inflammatory response. So Cheryl and Candace, you guys get the first calls with this.
So excited to have you all back with us. I have today with me a very special guest, Dr. Cassie Hartline.
So I'm privileged to work here at My Houston Surgeons as one of Dr. Rednam's associates, and I'm also about to have a baby.
We are very excited for Dr. Hartline, and we thought it would be really cool for us to talk a little bit about the changes that you observe and we see with pregnancy, not just because we're women, but we're also plastic surgeons. So I think we have a very unique perspective on that. Tell me a little bit about what you've noticed.
Yeah, so it was fascinating. From the first positive pregnancy test, I already noticed changes in my body, and I was eating nothing. I think I had 2 applesauce packets a day, and my breasts still grew exponentially. That first trimester, and then throughout my pregnancy, I felt pretty fine, had a few complications, but just the kind of generalized swelling, the consistent growing of the breasts, and the change in their color. And then obviously the tummy getting bigger and potentially stretching out, get a little itchy, which I think could be a sign of getting some stretch marks or something. Definitely want to moisturize through that. But all in all, not too bad.
Not too bad. You've probably noticed, if you haven't, I've noticed your skin is glowing.
Yeah,
and
probably sweaty, but
but it's a great side effect, right, of pregnancy, because you have all the increased blood flow, everything. Your lips look better, your skin looks better. So there are a lot of obvious positives besides the big positive, which is the baby.
Yeah.
But it's interesting. So for you, your breast growing, do you feel like that's been a positive for you? Is that something that's new for you?
For me, no. I had kind of probably normal sized breasts, TMI, and they're just very uncomfortable. It's definitely something that I can sympathize now more with my patients about what they're kind of going through when we have patients coming in for breast reductions and stuff. So.
I am joined again by Dr. Cassie Hartline. We had so much fun. We're doing it again.
Yes. And I'm still pregnant. The baby has not come out since the last podcast.
So we thought it would be nice to talk about awake procedures. So we're going to cover all sorts of awake procedures, something that's gained a lot of popularity. There's a number of reasons I think that people want awake procedures. If you don't have to pay for the facility of an operating room and anesthesia, what are some of the reasons you think people are more interested in awake procedure? And welcome back to the Confidence Doc podcast. I'm very excited because I have a very special guest with me today, Tonya Spanglo, better known as at Taking Back My Life at 42.
Yep. I'm excited to be here. Thank you for having me.
It's exciting to have Tonya because you were actually the first patient that we were having on the show. I wanted to kind of see if you would be willing to share a little bit about kind of how you found us and what your experience has been like so far. And just for reference, Tonya is now 8 weeks post-op.
Today. I'm 2 months today.
Oh,
so
wow.
That's exciting. I know, it's flown by. Now I can say that. In the beginning, it did not fly by. Pop Recovery, Laura, the CEO of Pop Recovery and Bariatrics to Plastics, she connected me with you guys. And like I said, I had several consults before and they were all men. And as soon as I met with you, I knew that you were the one for me because you made it all about me. You made it about, what area was I most self-conscious about and what did I think was feasible? What could I get through? Because I need a lot of skin removal. And how much could I do? And just all the things that go along with it. You answered every question I had. And so far, the experience has been amazing. It's exceeded all my expectations. And not just because you're sitting here, but I've told everybody that. If you can get with Dr. Rednam, I had somebody I was visiting with yesterday. She's booking a consult with you.
Oh, that's awesome.
And it's straight off of my recommendation because she was like, the way you talk about Dr. Rednam is did you guys know each other before she did your surgery? And I was like, no, I didn't know her at all. We literally met. We had consults and Zooms over the phone.
Uh-huh.
I sent my pictures in, and the rest is history from there. So I'm super pleased. It's just like I said.
As you can see, we are going to be doing a podcast today that is going to be a bilingual podcast. I do apologize that my Spanish is a work in progress, but I have with me today
Mayra Gamboa, who is a wonderful bilingual nurse injector, and she's going to be discussing with us today a little bit in Spanish, a little bit in English for any of our bilingual listeners today. So, Mayra, tell our audience a little bit about yourself.
Hi, everyone. My name is Mayra Gamboa. I have been a nurse for 8 years now. I've been doing aesthetic work for 3 years, and I'm obsessed with it. I definitely enjoy boosting my patients' confidence, working on patient balancing, enhancing their beauty, just seeing their happiness once I'm done with their treatment. It really fills me with joy.
I'm very excited about this episode. I have a very, very special guest, Miss Erin Ho, with us today.
Hello.
Erin is, well, actually, Erin, why don't you introduce yourself?
Oh, man. I'm Dr. Rednam's physician assistant. I've been working with you for about 6 years now, almost. I'm in the clinic as well as in the operating room, so I have one of those unique experiences where I get to see both in clinic, before and after, as well as like in surgery. So I'm kind of there through the whole process.
So Erin wanted to talk about something. This was her idea, and it is such a good idea because I think it's very relevant today. And we wanted to talk about weight loss medications.
Mm-hmm.
It is a very hot topic. Everyone thinks they can do it.
Everyone thinks they can be on it. It's like advertised every other advertisement commercial on TV.
Some people are very positive about it, and some people are cruelly negative about it.
Yeah. I have personal opinions about this, but I think it's important that people get good information, good facts, good data, and like to really decide whether they should or should not take it, and then what are their risks when they do, and how they should take it too.
So, Erin, you do a lot of these consultations.
Mm-hmm.
So let's talk about, like, in our practice specifically, we don't necessarily advertise as that we offer the GLP-1 medications. It's more if we have patients who are already established, patients who've either had surgery already with us or maybe having surgery and need some help, that we kind of offer it, right? So when you start talking with somebody about it, like, how do you start that conversation?
Usually, I don't usually start that conversation. The patient starts that.
Fabulous. And I wanted to make and dedicate this entire episode to Erin. Erin is my physician's assistant. And I want to clarify, because on social media, people seem to get irritated when someone says that. I don't own Erin. When I say she's my physician's assistant, it's because she works with me. We work together as a team. And I thought I really wanted people to understand better why Erin is such an important part of our team. So, Erin, can you tell people exactly what it involves to become a physician's assistant? Like, how did you get there?
Yeah. So a physician assistant is usually, now it's a master's degree. You hold a master's degree. So you went to graduate school at an accredited physician assistant school. The training it takes to get there is very fast. Usually by the first year, you are taking classes within your 12 months of training. You're taking classes with second year med students who've already been in school for 2 years. And then you go on clinical rotations. So as a PA in training, most programs, they train you throughout all the specialties, with an emphasis on family medicine. So at the end of your training and stuff like that, you can get a job in pretty much any specialty of your choice. The only controlling factor is having a supervising physician who is willing to train you, especially if you're new or wanting to switch fields. One of the benefits of being a PA, I think when I first started looking at this job, was that you could switch specialties and stuff like that. There's a lot of flexibility too as well. And I think a lot of it is to do with work-life balance and stuff like that. But as a PA with a master's degree, you are able to diagnose, you're able to treat, you can prescribe medicine, you can see patients, you have a relationship with a supervising physician. But at the same time, you can run very autonomously by yourself, especially in rural areas where there are not a lot of providers, or you can run and work in a big team or in a surgical team like I do. So there's a lot of different roles as a PA. I think one of the things about being a PA is the role of a PA is what the physician and the PA determines the role to be. It fulfills the need of what is asked for patient care. So it's pretty flexible, but it's pretty fun. I didn't go to med school, but you get to do a lot.
So people can understand how smart you are. Like, what kind of acceptance rate is it? Like, how many people apply for PA school in this country?
So the last time I was in PA school and I was helping out with their interview process, they said that they kind of stopped looking at applicants after 2,000 applications. And from the 2,000 applications, they interview maybe 200, 180. And from the 180 applicants who get an interview, largest class, which is from UTMB, which is where I graduated from, is 89 seats. And then the smallest class, which is like I've heard of, is like 34. So each year, only 34 PAs graduate. Like Baylor has, I think, 34 or 40 slots. And so most schools actually are very, very small. So they're not very big. But yeah, the acceptance rates, if you do the math out, it's pretty staggering. It's, I think, about anywhere from 3 to 5% acceptance rate.
Welcome back to another episode of the Confidence Doc podcast. I'm Dr. Rednam, and I'm very excited today. We have a special guest. We have Dominick Richard. She has been a nutritionist with Pop Recovery. She's also certified in Ayurveda, and I'm very excited to introduce her because I think a lot of people don't realize how important nutrition is to their plastic surgery recovery results. So thank you so much for joining us today, Dominick.
Thank you, Dr. Rednam. It's an honor to be here.
For our listeners, a lot of people, like I said, are just not familiar with the importance of nutrition. But can we talk first a little bit about your background, how you got involved in becoming a nutritionist?
Absolutely. So it was on my personal journey to health that I decided to study nutrition. And the first thing that I came upon was plant-based nutrition. And I knew there was something to it because we talked about the anti-inflammatory diet. And that is precisely what we promote in pre-op and post-op nutrition. So we'll dive more into that later. That was the first branch of nutrition that I came across. Then I started to work in the fitness industry and was recommended to get certified with the National Academy of Sports Medicine. So I became a certified nutritionist through them. And finally, I'm also a yoga teacher, and therefore I was introduced to the Indian system of medical and lifestyle, which is known as Ayurveda, which I'm sure you're also familiar with. And so I did 200 hours in Ayurveda, and I surprisingly integrate a lot of Ayurvedic nutrition for recovery because it's all about healing and rebuilding tissues. So it's really perfect for surgery.
That's wonderful. How did you get involved with POP?
So Laura has been a really good friend of mine for the past 10 years. And after she had her plastic surgery, she requested my services to work with her chef. And she thought to herself, every patient should have access to this because as you're recovering from surgery, you might not have the energy or the full capacity to create your meals, but to also choose the foods that are going to support your healing and that are going to also minimize the inflammation or swelling that most patients are aware of.
Exactly. And I think that a lot of people don't think about the aspect that when you have surgery, you are putting stress on your body. You're also pushing your body to recover at a different rate than it normally does. And that requires nutrition, that requires energizing your body. And so you do have to look at before, during, and after surgery in different ways. If you aren't doing that, you're not giving your body all the fuel it needs, right? So when you meet with somebody before surgery, what are the things that you're stressing and the education that you're giving to them?
Good question. The pre-op is probably just as important as after. A lot of people focus on the recovery, but if you have the opportunity to begin working on your nutrition before, we start as early as 6 weeks for plastics patients, and especially for bariatrics because they've gone through a journey of prioritizing protein, low carb, and a lot of them are having inflammatory foods. So what I mean by that is processed or away from the natural state or original state of food. When we meet patients before surgery, we stress the importance of integrating natural foods in their diet, foods that the body recognizes that are going to actually prepare their immune system for the inflammation that is going to show up after surgery, which is a normal result of surgery. As you mentioned, Dr. Rednam, there is a certain amount of stress being put on the body. Therefore, how can we prepare the body, building its strength before encountering? It's almost like you're preparing yourself before you get a cold, right? If you knew that you could build your immunity we would all be doing it. So it's kind of the same thing for surgery. And what we've noticed is that the anti-inflammatory diet, which consists of removing the principal inflammatory foods, substituting them for the anti-inflammatory counterpart, we've noticed a great increase in overall health, immunity, and decreased swelling post-op.
And what I love about thinking ahead of surgery with it is that after surgery, we're always talking about, okay, we're using ibuprofen to potentially reducing inflammation. We're using icing, we're using massage. This is just us getting another aspect where we can reduce the inflammation. At the end of the day, inflammation and swelling becomes scar tissue. Just another way for us to kind of approach that to optimize somebody's results.
I love how you're mentioning this. A lot of patients talk about how we could prevent keloid scarring and fibrosis. And you just mentioned that inflammation that goes outside of the normal spectrum, so excessive inflammation, can turn into scar tissue. That's amazing. That's new to me.
And so if think about all these components, which like you said, so many people focus on after, but it's just like a marathon. You're going to train beforehand. You're going to be eating properly, you're going to be hydrating, and then you're going to do really well in your race. To me, that's the same way that surgery should be approached, especially elective surgery. Is like we can prep your body and your mind to do the best it can.
Wow, absolutely. Mm-hmm.
So what do you normally talk with? So I know that you kind of prep people beforehand. What are some of the things that you tell them to do? But so you're looking at anti-inflammatory foods. Are you changing what their calories are beforehand? Are you changing protein intake, carbohydrates? What do you generally are recommending at that point?
It's a really case-by-case approach, especially because a lot of major weight loss patients come from bariatrics. And therefore, when they do already have the bariatric program focusing on protein, normally we make sure that they have at least 1 gram of protein per kilogram of body weight. However, this varies. Everybody is in a different position, and we meet the patient where they're at. I think that the low carb could be a little detrimental to the healing because carbohydrates are essential not only for brain health, but for glucose and also rebuilding the tissues. Yes, protein goes a lot into it, but we need to have enough food, enough calories, so the body has where to build with. It's the same thing in fitness. If you want to build muscle mass, you need enough protein, but you also need enough calories. And whenever there's a fat transfer, we even talk about eating above maintenance calories to avoid going into catabolism, because if there's loose fat cells and the body is hungry and needs quick energy, it could grab on to those loose fat cells, versus once they're rehomed and really set, it becomes a little bit more difficult. So we make sure that they're eating enough, but that they're eating healthy sources of food and healthy calories that the body can convert into healthy tissues instead of inflammatory tissues.
I love that. And I love, too, that it's putting you in this mindset before surgery. Let's say maybe you hadn't been making the best nutrition choices, that you're already getting your body used to that. So as you're going through surgery and afterwards, maybe you start making some really good changes in your diet as well.
As we wrap up another episode of The Confidence Doc, I want to extend our heartfelt thank you for being a part of our community. If today's conversation resonated with you, remember that Dr. Rednam and her team are here to support you on your journey to self-confidence and beauty. Your story is unique, and it's our privilege to help you create the masterpiece that is your life. If you'd like to book a consultation with Dr. Rednam, you can visit her webpage at drrukminirednam.com. Fill out a contact form, and one of her coordinators will get with you accordingly.